Good morning, folks. How are you this morning? A bit chilly out there this morning, but it's great to be alive, isn't it? I'm always pleased when I wake up, you know. I've been waking up now for 72 years. Anyway, this morning I'm going to talk about something special. I know you've all been waiting for this. I'm going to talk about the Mental Health Act and how powerful the Mental Health Act is. And I'm going to do it by recording my story on video. I was 5 days put into a mental institution or a mental hospital for 5 days against my will. I was put there under the Mental Health Act. And this is day one. I'm reading from the notes. I took notes while I was in there, and I'm reading them exactly as I wrote them. It's Wednesday, the 31st of July 2013, and I'm talking about true stories in the life of Ronnie B. The price you pay for painting a pub. 5 days in a mental hospital with no computer or mobile phone. Confined into a small room with a 4-drawer cabinet to hold your overnight clothes. No Bible in the drawer, one chair and a single bed with a wire mattress. I had to borrow the pad and pen from the hospital because I never bought the old-fashioned writing tablet with me, and my laptop was taken from me. I was enjoying some texts communication with my daughter in Melbourne and my other daughter in Timaru. This ended when they took my mobile phone from me. I rang my wife Margaret, but the phone is always engaged. She will be busy telling all her family and friends that I have been put in a mental hospital under the Mental Health Act. The nurse came and asked me some questions that I missed when filling out the form. She explained to me that they took the mobile phone from me because I might film other people in the ward. I can phone my daughter in Timaru, but I will lose all communication with my daughter in Melbourne for 5 days. They will decide in 5 days' time or if I will be held for a further 14 days. If I'm held longer than 14 days, I will go before a judge to decide if I am permanently mental, unstable and require long-term care. My doctor's from one of the countries who are black-skinned people, and he is the one that enforced the Mental Health Act on me against my will. He has asked me not to mention his name in my story. I started writing my life story on the internet in May 2012. At this moment, I've loaded over 400 videos onto YouTube. And you might be interested to know that this video is number 453. Some of the stories on my experiences with sickness include bipolar disorder, Alzheimer's disease, prostate cancer, trauma and anxiety. Employment law. I spent 5 years of my life defending a personal grievance claim. I was forced to pay a dishonest employee over $35,000 after they sell our family home. Prayer. I have just prayed to God and asked Him why He has put me in here, in this place. Surely I have a job to do for you, God. What is that job? Why have you taken all my rights from me? Am I crazy? Yes, I do things that are different, and that is because I say affirmations every day. I am the greatest and funniest motivational coach in the world. I uplift people. I inspire people. Why? Because I am the greatest and funniest motivational coach in the world. I am waiting for God to reveal to me what I'm doing here. I will not stand for mere. I will sell advertising to cover the cost of promoting Timaru. I will no longer ask for donations. I've just phoned my wife Margaret to ask if she signed a form to put me in here. I was told by the lady shrink that the reason I'm in this ward is with all young people is because the hospital for elderly patients is full. I feel that I have been betrayed by the system. I refuse to make friends with the young mentally ill patients because if I do, I'll become like them. My rights. All the young people in the ward are allowed cell phones. Because I am under the Mental Health Act, I am not. This means I am not permitted to text my daughters. The young people that smoke are allowed to walk outside and smoke. I went out to get some fresh air and 2 nurses came out to make sure I did not run away. The name of my doctor is Dr. Cyrus Barathon, and instead of getting my wife to sign the form, he got my eldest daughter Kerry to sign it. I've been given an informed consent form. I want to ask lots of questions. I asked my nurse if I could have a dictaphone, but no, I am not allowed to dictaphone to dictate my thoughts. I told my nurse that I must be classed as a high-risk patient. He told me I might walk around with it in my pocket and record other people's conversations. Could I please see Jackie Pringle? Is there a law that prevents me from publicly naming who my shrink is? Blood pressure. My nurse told me someone would take my blood pressure, but that has not happened. I told the nurse that if my blood pressure caused by the stress could lead me to have a heart attack. Complaints about me. Dr. Barathon said he had received no complaints about me, about my state of health, from any member of the public. The nurse took my blood pressure and I am 155 at 7:45 p.m. They took my medication from me. It's 8 p.m. and I have still not been given my medication. My woman nurse is a student and this was her first day on the ward. Things I'm not happy with. No mobile phone. No computer. No dictaphone. No exercise. Treated as a high-risk patient. No one has complained about me. Who is calling the shots? Why is Dr. Barathon's name secret? Why was my next of kin consulted? That's the end of day 1. My next video will be day 2, which is Thursday the 4th of August 2013. So that's the end. That's what I wrote down. I didn't change anything. Dr. Barrathan asked me not to use his name, but it was too late. I'd already written it in my notes. And those are my notes. And they will be used to write my story. It'll be in a book, may even be a film. But I'm here for that reason. I'm here to help people. You're going to hear me a complete change in my attitude each day as I go and record my story in what I call a low security prison. So until tomorrow, see you later. Bye bye.